How does CPAP pressure affect pulse rate variability, HRV? Have you ever wondered how the pressure from continuous positive airway pressure therapy influences your heart's rhythm during sleep? Let's break it down in a way that's easy to understand. Continuous positive airway pressure therapy is a common treatment for obstructive sleep apnea, a condition that interrupts breathing while you sleep. This therapy works by providing a steady stream of air to keep your airway open, which helps improve oxygen levels and reduce the number of breathing interruptions. Now, pulse rate variability refers to the time differences between heartbeats. It gives us a glimpse into how well the autonomic nervous system is functioning. This system controls our body's involuntary actions, balancing between the sympathetic system, which prepares us for action, and the parasympathetic system, which helps us relax. In individuals with obstructive sleep apnea, this balance is often disrupted due to factors like low oxygen levels and sleep disturbances. When you start using CPAP therapy, you might notice some immediate changes in your pulse rate variability. On the first night, studies show a decrease in overall pulse rate variability, particularly during non-rapid eye movement sleep. This indicates a quick adjustment in your autonomic activity as your breathing becomes more normal. Interestingly, there's also an increase in the high-frequency components of pulse rate variability, which are linked to the parasympathetic system. This suggests that your body is starting to find a better balance. In the short term, as CPAP therapy continues, it stabilizes your breathing patterns during sleep. This can lead to a reduction in overall pulse rate variability during sleep, likely because your heart rate and breathing become more consistent. Over a longer period, like a year of regular CPAP use, you may notice a slight decrease in resting heart rate and some improvement in pulse rate variability measures. However, changes during sleep might not be as noticeable. The mechanisms behind these changes are quite interesting. CPAP therapy reduces the episodes of low oxygen and nighttime awakenings, which helps lower the overactivity of the sympathetic nervous system. This shift leads to a more balanced autonomic state with increased parasympathetic activity and decreased sympathetic activity. Improved oxygen levels and less effort required for breathing also ease the strain on your heart, which is reflected in the changes in pulse rate variability. Monitoring changes in pulse rate variability can offer valuable information about how well CPAP therapy is working. Adjusting the pressure on your CPAP machine to ensure your airway stays open can help restore your autonomic function, which may lower the cardiovascular risks associated with obstructive sleep apnea. Analyzing pulse rate variability can be a helpful part of interpreting CPAP data, allowing for better management of your sleep apnea treatment. In summary, the pressure from CPAP therapy plays a significant role in improving the balance of your autonomic nervous system. This results in increased parasympathetic activity and decreased sympathetic activity, leading to better heart regulation during both sleep and wakefulness. These changes can help reduce the cardiovascular risks linked to untreated obstructive sleep apnea.